Well, it's 1:30, so I think some more people will still be joining, but we will get started. Welcome to today's Batten Chat. I'm Ben Castleman. I'm a professor at Batten and at the Curry School at the University of Virginia, and I direct the Nudge4 Solutions Lab, which I'll say more about in just a moment. Before I do, let me turn it over to my colleague Brian Kim to do a short introduction.
Hi, my name is Brian Kim. I am a third-year doctoral student in education policy at Curry. Ben's my advisor. I work in the Nudge Lab, and I also just got my MPP through Batten last year.
Great. Thanks, Brian. So at Nudge4, we work with public agencies and organizations to use data science and nudge strategies to design solutions that connect people to educational and economic opportunities. A lot of our work happens right here in Virginia with the Virginia Community College System, or VCCS, as you may hear me use going forward. To give you a couple examples, one project that we've done with the Virginia Community College System focuses on increasing college graduation rates among students with most of the credits they need for a degree, but who are at risk of dropping out before finishing. We use data science methods to identify and predict students at higher risk of dropout than their peers. And then we use nudges to keep them on track academically, to connect them to campus resources, and to help them get support to an advisor when they need assistance. In other projects, we're using the same methods that we're all probably quite familiar with these days, spending a lot of time on Netflix and other sites, the same methods that Netflix uses to recommend what shows or movies you watch. We're using those data science and machine learning methods to give students very tailored information about courses they can take that maximize their predicted probability of graduation and transfer and that meet degree requirements. Brian and I, and he may talk a bit more about this in a moment, are also doing a lot of work right now on using some of those same methods to give students who are about to graduate from college very personalized information about jobs that are currently
It looks like Ben's screen might have frozen. Ben,
yeah.
You go back like 2 sentences, and then I think you're good.
Okay. So technological glitches of the world we live in now. Where did I cut off, Brian?
I think right as you were about to start explaining the job pathways, job matching.
Okay, great. Thanks, Brian. So I was giving just another quick example of ways that we're using data science and machine learning methods, and that's to provide. Am I frozen again, Brian?
Yeah, it looks like a half second. Keep going.
Okay, to give students who are about to graduate from college personalized information about open jobs that their academic profile suggests they would be a good match for. As is the case at the University of Virginia, in many public school districts, and just about every public and private organization across the country, the COVID crisis has had and continues to have a dramatic effect on the Virginia Community College System and the hundreds of thousands of students who are currently enrolled or enrolled at any point in time. So Brian and I, our colleagues at Nudge4, are pivoting our efforts as much as we can to bring data science and nudge strategies to bear to support student success and students' transitions both into the labor market and, if they're out of work, into relevant training opportunities. So I'm going to turn it over to Brian to talk about one of the projects specifically that we're working on. Let me also just note that after Brian shares this current project and might talk a little bit about the job pathways work, we're going to open it up for questions and really excited to engage in discussion. To do that, you can use the question and answer feature at the bottom toolbar. Please post your questions there rather than in the chat feature. We'll be monitoring and responding to questions. So Brian, with that, let me hand it over to you.
Great, thank you, Ben. So to speak to one of the projects that we're working on specifically for COVID response in the context of the Virginia Community College System. So one thing we know is that VCCS is like an enormous source of health professionals in Virginia, from respiratory therapists to nurses and much more. And so one thing we know right now is that given the crisis of COVID and given the sort of differential impact of COVID across localities, we also know that specific localities and health providers are experiencing some pretty acute shortages of specific staff and skill sets that they need to help best treat individuals who are suffering from COVID. And so one thing that we've been doing with our partners is to figure out among the graduates that we've seen recently, so students who've graduated in the last 2 to 5 years, among those students who've graduated with a relevant health credential, especially a health credential that is pretty key in terms of helping to support people suffering from COVID, which of those individuals from the last time we saw them in our data are currently unemployed or were employed in a field or profession outside of health? And so with that information, we're hoping that we can essentially provide localities and health providers with the information of like, here are these people in your region who have the credentials that you're looking for the very specific skill set that you need and that you currently have a shortage of. And our hope is basically that by providing that information to policymakers in the area, the policymakers can then work with the Virginia Community College system and those health providers to kind of connect those people to providers, figure out if they can help out and support in the responses and sort of what it would take to get them into the front lines. So whether that's a combination of resources, whether that's a combination of information, or even potentially incentives. And so to give you all a little bit of a sneak peek at what this looks like, you can follow along. Hopefully my screen is currently being shared. Let's see. And so this is the dashboard that we constructed basically to take the information and the analyses that we created in these response efforts and to put them into a format that's easily accessible for a non-technical audience, especially amongst policymakers who are currently very, very bandwidth constrained, have a lot going on, and may need some help to basically navigate the information, find the information that's most pertinent for them and their localities, and act accordingly. And so if you're interested in following along, you can see the short link right here is nudge4.org/COVID-19. If you want to bring that up on your own screens or just follow along with me. But basically you can see what we've done is we provided a map of Virginia, the various college regions, and then for each college region, we're showing a combination of the students with the health credentials or recent graduates with health credentials in that region, alongside the current COVID case counts, past COVID case counts, and counts of hospital beds from the Urban Institute. And so the idea here is that by providing policymakers with this sort of relevant information and then also providing them with the relevant options on this side panel to select the very specific groups of students and groups of graduates they're most interested in, whether that means that they're interested in, say, for example, respiratory therapists or nurses in particular, they're allowed to then click on which ones they're most interested in and see a filtered result here as well. And then based on this information, we also break down the information further to show which sort of groups of students the map is counting and where, what kind of degrees they're receiving, and which programs that they studied as well. And so the idea here is to just take a lot of dense information, a lot of dense descriptive statistics, and help them kind of take that information and take that information into action is ultimately the goal here. So as I mentioned earlier, this tool is currently in the hands of policymakers. They're working with the Virginia Community College system as we speak over the past couple of days to help coordinate some of these response efforts. And our hope is basically just that by doing this sort of analysis, by running these sort of data science analytics and providing that information in a timely, specific, and easily understandable manner to policymakers, that we can really just support some of the major issues that, or support solving some of the major issues that hospitals, health providers, and others are facing right now.
And Brian, do you want to say a quick word about what's available to the VCCS on the back end in terms of the kind of specific student information and how we think that might be useful to the community college system or other agencies in the state in terms of outreach to individuals?
Yeah, I mean, so on Virginia Community College system side, they have information about these graduates, everything from their home address, given that they're in these sort of administrative student systems, as well as their most recent employment information. So as part of the information that the Virginia Community College tracks is, where have they been employed, when have they been working, where have they been employed, and try to better understand, and that's part of the research efforts of trying to just better understand the trajectories of community college graduates in general. But with this information, we have a much clearer picture of sort of what are the credentials that these students are really would be coming to health providers with, what sort of experiences might they have, and where are they currently? And so having that very updated information on their end at the disposal of policymakers right now as they're coordinating for this crisis is hopefully going to be invaluable in really tracking down who's most able to help right now, who's in what circumstances, and where they are.
Great. Thanks, Brian. Well, we're going to turn it to your questions, and it's great to see that there are several already. Just a quick reminder, if you do have questions or thoughts, we'd love to engage with you, and please use the Q&A feature at the bottom. I should also note that Brian and I were both public school teachers, high school teachers, and so we're thinking a lot, both based on our own experience and kind of broader research and policy world about how K-12 schools are being affected by COVID, and so we're happy to discuss that as a topic as well. So let me start with some of the questions. Hi, Monica, great to have you on, and thanks for joining. I'm going to get to the middle part of Monica's questions, which I'll ask Brian to weigh in as well, and they largely deal with the kind of how we develop this dashboard and how we are aiming to use it in a little more detail. So maybe Brian, if I can take a first stab, and you can feel free to add anything. One of Monica's questions is whether there are best practice models of workforce recruiting dashboards in other states that we modeled this one after. I'm sure there are, and I think in a general sense, Brian was really responsible for the visualization and dashboard creation. I'm sure there were some general models that Brian drew on. We wanted to produce this as rapidly as we could, and so it's really more something we built up from scratch, designing in as kind of user-friendly a way as we could to inform policymakers about the relationship between healthcare labor supply and where there are higher rates of COVID. And that's, just the from scratch nature is just because of how rapidly we wanted to get this in the hands of policymakers. Monica also asked about rollout. This is currently, as Brian said, in the hands of the community college system, the governor's economic strike force. It's also something we've shared through some of our networks with other states. Certainly for anyone on the chat, if you think the dashboard would be useful to a state or city or other organization you've connected to, feel free to pass it on. We've linked within the dashboard the methodology, both to create the data calculations and to build the dashboard itself in the hopes that it's as replicable as possible. In terms of localities that we would aim to target first, I don't know that I have a good answer to that. I think the way I would attempt to answer that is to say, our hope is that state policymakers, health officials, who know the most about where they face the most acute needs, can use this tool and understand, okay, if we need respiratory therapists in Northern Virginia, or we need healthcare workers who can work in nursing homes in Southside, this is what the availability is, and then work with the community college system to reach out to those individuals on the back end and offer whatever combination of incentives or encouragement might support those individuals to help fill needs. So let me, I'll stop there just so we can get to some of the other questions as well. Brian, anything you wanted to add to Monica's questions?
Yeah, just to the question of design and sort of like starting from scratch. I did reference a couple of sort of community college graduate dashboards from other states. California has a really great one. Michigan also has a really great one. One of the things that kind of fed into our desire to really start from scratch here, though, is knowing that the sort of purposes of those dashboards are quite different than what we're facing right now. A lot of other dashboards that we've seen have been kind of focused on like figuring out like who's graduating with what, where, in a very broad, wide net with a lot of different options, a lot of ways to customize the output. But given that we have a pretty focused purpose here, and we really do want to make this as clear and concise for policymakers using it as possible, we really cut out a lot of features that we've seen on other dashboards. But we're just to be really clear, I'm still learning about visualization. I'm still working on those skills and would love any feedback that you all have, any suggestions you have, any thoughts. So feel free to reach out to me with those in the future.
Great. I'll go to Jesse's question next. Jesse asks how community colleges in Virginia themselves are being affected by COVID. What issues are they facing now? Some of them I think are similar to anyone who on the chat is a student or has a student in their family at UVA or other institutions. So the Virginia Community College System also made an abrupt and necessary shift to remote instruction, as happened at UVA. I think, so one of the challenges is similar in that students are just adjusting to learning in a remote environment. On average, the student population that attends the community college system tends to be older, tends to be from lower income backgrounds, more likely to have dependents, more likely to be working while in college. And so you could imagine from the student perspective, the added challenges and struggles of staying on top of classes, even though they've moved to a remote environment, while also dealing with the economic fallout from COVID, potential job loss that the student has had or that family members have had, or the needs and demands of dependents and others who are at home and affected. I think it's also the case, unfortunately, that our community college system, despite enrolling over 40% of higher education students in the country and serving a disproportionate share of our low-income and first-generation students, has on average much less in the way of financial resources to achieve their mission than universities like UVA and others have. And so I think on the side of faculty and advisors at community colleges, my guess is it's a challenge to deliver their mission with more scarce resources than other universities have. And then my guess is that the community college system, like a lot of universities, are probably contemplating potential enrollment declines because people are out of work and they might not feel they can afford college or university, or people might question whether enrolling in remote courses is as valuable as in-person learning, or there may be training programs that people want to participate in that require, quote, hands-on instruction that are harder to do through online. And so without needing to speak for our community college colleagues, my guess is those are at least some of the challenges. I think we're really fortunate and privileged in many ways in Virginia to have what I think is one of the top community college systems in the country in terms of its governance, its leadership, its commitment to innovation and research, and evidence-based practice. So I'm confident that we have as strong a community college system leadership as any state could ask for to navigate these challenges, but that the challenges are very real. So that's a great question. Brian, anything you want to add about community college challenges in the face of COVID?
Yeah, I think you touched on it, but one thing I do want to emphasize too is given the demographics of students, and then given also in Virginia especially, how many, what proportion of students at Virginia's community colleges currently live in rural areas. I think one major challenge that they're facing is that their students, even as classes move online, that their students may not necessarily have the infrastructure and access to internet that's required to really effectively take any of those classes online. And so I know that that's definitely one of the big challenges that they're facing as an institution, of figuring out how can we handle the move to online classes equitably, how can we make sure that access to these resources is still available to students, and how can we best support them over the next couple of months.
Great, thanks, Brian. So our next question from an attendee is, how could nudges be used to help the millions of students in K-12 and higher education who've had to make the abrupt switch to online learning? That's a great question. And this is something that another area like the dashboard where we've tried to pivot as rapidly as we can and put out some resources that we hope are useful to teachers, faculty, administrators, advisors. And so Millie or Aaron, I'll name a couple of these and maybe there's a way to send them as a follow-up to the attendees or post them through other Batten channels. So one of the things we created was what we think was kind of a cheat sheet, a very simple 1-2 page guide for faculty and administrators on evidence-based nudge strategies that they can use in their classrooms to support student success. So these are strategies like having students set concrete goals for what they want to achieve over the course of the semester, and to use those goals as reference points throughout the semester. There's good evidence that kind of goal setting and follow up on goal setting can help students achieve their goals. There's strategies around planning prompts. So there's a lot of evidence in kind of the nudge world about helping people make a specific plan for the time and place and location when they're gonna study or work on an assignment. Actually makes it much more likely that assignment will get completed, especially given how much our schedules have in many ways been thrown into disarray. And so, planning and committing to a specific 45 minutes to work on a paper at a location, at a time when there's quiet and concentration, again, strong evidence that can make a big difference. And then there's a lot of evidence on the potential power of reminders, reminding students about assignments that are due about resources that are available to them, and then using technology that makes it as easy as possible for students to connect with faculty, advisors, or other supports. So the cheat sheet is one resource. Yesterday, we did a training for advisors across the Virginia Community College system on evidence-based nudge strategies to improve student success, as well as best practices in remote advising that I think has some parallels for remote instruction. And we have a recording of that training that we're happy to share and may be useful. The other thing, which is a longer read, but also has a more in-depth set of resources, with one of our partner organizations, Ideas 42, a behavioral science design firm in New York, we created a practitioner's guide last year called Nudges, Norms, and New Solutions that gives a pretty comprehensive overview of evidence-based nudge strategies to improve post-secondary success. So again, hopefully through Millie or Aaron or other Batten channels, we can get those resources out to those of you on this call, or any of your colleagues that you think might find it useful. So I'm going to ask Brian, if you wouldn't mind, to take the next two questions. I might
Sure.
add in after the first, but you're certainly very well positioned to speak to these.
Yeah, so the first question I think that I'll answer here is, what other ways can people with data science skills make a difference right now? And I think this is a fantastic question. I definitely identify with this question in the sense that, like, I think everyone's kind of feeling, how can I contribute? How can I use the skills that I've learned, the expertise that I've gained to really contribute to a major crisis that humanity as a whole is facing right now? Two things I'll say in response to this question. The first is, I think something that we've seen a lot recently, especially if you're following a lot of social media channels and a lot of the news, is I think there's just a lot of people who are trying to make a difference and who are trying to help. And I think the difference between people who actually are making a difference and the people who are kind of just putting a lot of information out there is the extent to which they're really consulting with and working with field experts. I think right now it's really, really important that if you do have data science skills and you come from a data science background, that your instinct should be to reach out to people who know a lot about what's actually happening from the biological, virological, epidemiological perspective. And so working with those individuals and getting a sense for what actually do they need in terms of analytic capacity, what actually do they need in terms of taking the information they're constructing, the analyses that they're conducting, and conveying it to either the public or to policymakers or to practitioners. So I think the first order question is really, who can you get in touch with and collaborate with to really support their efforts in the current crisis? And then the second thing I would say is similar to what Ben and I are doing with our COVID dashboard, is if you are coming from a particular background with a particular disciplinary focus and access to very particular contextual data, thinking carefully about how can we focus on this data, how can we reframe this data, how can we look at this data in conjunction with other sources of data to provide new insight on a particular issue and a particular problem that people are facing right now. So Ben and I come from this education background, education policy in particular, and community colleges in particular. And we really asked ourselves, we can't necessarily speak to anything useful about the spread of coronavirus, for example. We don't really know enough to give context about, which places are hardest hit from an epidemiologic perspective. But what we can do is we can say, like, we have these data about community college graduates, many of whom are coming into the health professions, and how can we use that information in a way that's actually going to support efforts on the ground? So I think the two things that I would say to kind of summarize is, one, think about who you can collaborate with and how you can support them in their efforts. And then secondarily, if you do have certain sources of data, certain access to information, thinking about how that information could be useful to people who are coordinating responses right now. Ben, anything you want to add there?
Sure, I agree with everything Brian said. I would also just share on a more local, well, everything Brian said was local too, but within our lab, because I think we've made a lot of investment, put a lot of time into building strong relationships with agencies like Virginia Community College System here in Virginia, but really all over the country. I think we have a fair amount of opportunity right now to bring data science skills to bear to help our partners and work with our partners to address COVID crises, whether they're in education or workforce. We have done, as I alluded to at the beginning, a fair amount of work training prediction algorithms for various purposes, helping students choose what courses to take, helping predict who's going to graduate. And I think we have a fair amount of opportunity to repurpose those algorithms for very COVID-specific opportunities. So without going into the details right now, given that we have relatively limited time, I would just say, if you have machine learning skills in prediction and recommendation engines, and you're interested in bringing those skills to bear on the kinds of projects Brian and I are discussing, please feel free to reach out to me. We can, again, maybe Millie or Aaron can send out our contact information after, or we're fairly Googleable. Again, there are, I think, direct ways people could get involved. In the interest of time, Brian, maybe we could turn to the next question, if you don't mind taking the lead.
Yeah, so the next question is, how do you recommend Batten students or other students at UVA get involved with data science while they're here? And what opportunities do you suggest? So I'll speak to the Batten experience, having just come from the Batten MPP. The classes that you take there in econometrics give you a lot of the sort of foundational skills and foundational data work, analytic skills that you need to kind of start your journey. I will also say UVA has like a ton of really wonderful opportunities, both in the School of Data Science, which I know philosophically is kind of approaching their role as like the school without walls. And then secondary, also through other departments of the school. So our classes in Batten that are focused on machine learning, I think of the public interest data lab that I'm currently helping out with, where students learn some basic data science skills, basic R, and apply it to a very practical applied project that serves the community. I also think of classes in psychology school, or the Department of Psychology, which includes Introduction to Machine Learning, also includes Introduction to Bayesian Methods. There are courses in Stats department, there are courses all over the university. So I think it's really just a matter of kind of taking a peek at what's out there in the course catalog, reaching out to professors, asking them what's appropriate for your skill set and where you currently are, and then just really trying to take advantage of those opportunities. In addition to any sort of projects, any sort of professors that you know, in which those skills can really be fostered. There's a lot more detail that I'm happy to give, but again, in the interest of time, I'll pause there, and feel free to reach out to me if I can be any more support as you learn these things. Ben, do you want to add to
that? I agree with everything Brian shared, and I think Brian has done really an exemplar in many ways of seeking out, even before our School for Data Science, seeking out resources as he shared at Batten, from the psych department, from stats. And certainly, I think we're all incredibly excited by the new School for Data Science and the opportunities for further integration. I think we have time for just one more question, and I'll go with the next one on the list. What's been a challenge our lab has faced during this pandemic? It's a great question. I would have answered the question differently and perhaps with more concern a couple weeks ago than I feel right now. I think the two concerns I would have faced is that, we're a lab at UVA, but we're a lab that's dependent on philanthropic support and funding to carry out our projects. And for very understandable reasons, many philanthropies are having and choosing to pivot to use their funding to address incredibly pressing and immediate needs, right? People's shelter and food, and immediate security, and that makes a ton of sense. And so I think one of the challenges I thought we would face, and we still may very well face going forward, is a fiscal one. How are we going to fund the work that we do? And we've been really fortunate with a combination of our private philanthropy and public philanthropic partners to have a great deal of latitude and flexibility on how we allocate our resources, the timeline over which we can expend our current resources. That has allowed us to pivot in the directions and in the ways that we have. I'd say another quick challenge is that a lot of the projects we had been working really hard on, and were in many cases on the verge of putting in the field, so to speak, were really kind of frozen in time. And so certainly that's a challenge. We've tried to make lemonade out of lemons, so to speak, and recognize that challenge is inevitable and pivot in the ways that we've described to still bring the skills or experiences we have in data science, in behavioral nudges, and other strategies to support our partners. So with that, we're unfortunately at time. Really appreciate all of your engagement, and just to reiterate, Aaron or Millie will be following up with the recording, an overview of today's chat. we are happy, Brian or I, to engage with you coming out of this conversation. And please stay tuned for upcoming Batten Chats by some of our fantastic colleagues. So thank you again all very much for being with us.